So this treatment is the body galvanic treatment. It's a treatment that's going to allow product to be forced deep into the tissue. So for whatever reasons you need it is the product that you're going to use. Today we're going to be using the anti-cellulite cream. It must be a galvanic gel. It must say galvanic gel or it's not going to work. So we have set up already our G4 body galvanic machine, and we have already put the dials on plus, which is how we're going to start the treatment. At the end of the treatment, we know that we're going to put those on minus to rebalance the skin again. But to start, for this machine, it's plus, and you always read the manufacturer's guidelines so that you know what each machine requires. We've got our bowl of hot water. It isn't boiling, it doesn't need to be boiling, but the client won't be particularly happy if it's freezing cold because it's going straight on her skin. And we're going to now put that out of the way, and we are going to make sure that every single one of these pads cover the rubber pads that we have ready here. So we have 4 outlets, each 4 outlets separate into 2, a red and a black. We need to put our sponges over the rubber pads, and we make sure that every single sponge covers the whole pad. If you've got this situation where it is too small or not placed on properly, that is where it's going to burn your client. So it needs to be completely covered. If you've got any tears, breaks, cracks, damaged sponges, then the current's going to go through those cracks, and that's where you're going to cause a problem for your client. So they must be perfect. So once we've got those on, we need to make sure that we have enough product on to do the treatment, but not so much that you can fail assessment because we've wasted product. So we have a clean spatula, and we're going to apply the gel directly onto the sponge. Now normally it takes about four pumps, and we cover that. This sponge is particularly big, but 4 has still done the job. Now these sponges have got little waffle effects on, which allows the product to sit in that waffle grain. That's a good thing because then you know that you've got enough product sitting in those grains for it to apply to the skin and work. If you need it, you haven't got, it's not on too thin, you don't want it on too thin. So you're going to do that on all of your sponges. Now I know a lot of people say, well Miss, can we do that before the client comes in? My advice would be no. The reason being is if your client doesn't turn up, then you've wasted a great deal of product and time. And if your client's late, the sponges will be freezing cold, and they will be cold anyway, so you don't want them any colder than what they need to be. So you should do that when the client's here, and obviously I'll need to watch you for assessment as well. So you do all of those, but I'm going to show you where you apply them and then what we're going to do. So we've got 4 straps, 2 knee straps, which will range between small to medium, depending on your client. You've got 2 straps on the thigh, because that's what we're working on today is the legs. And again, you would have medium to a slightly larger medium. The other straps you will know are for the body, so they're a lot bigger. So the straps are in place. You would have done your consultation, you'd have sat with your client, you'd have discussed what it is they want done today. My client, for all intents and purposes, it says cellulite, so that's what we're going to do. And then we would be discussing with our client where the problem area is. So Is it the inner thigh that she has got most problems with? Is it the outer thigh? It might be both sides, but for your client, she might say, well, look, you know what, the outside is more of a bother to me at the moment than the inner thigh. So you are checking. Don't assume you know where your client's problem area is. Ask her. Yeah? Check with her at the beginning of the consultation. So the straps was all in place. My client has a towel, which I will cover with to keep her warm once we get the treatment going, but we've now got to get these in place. So the first thing we're going to do is make sure that your machine is off and make sure your dials are all on 0. The next thing you're going to do is make sure you're on the Polarity Plus for this particular machine. And now we're going to place our pads. My client has said her concentration area is the outer thigh. So the lead that has the black plug attached is the one that goes on the problematic area for your client. So I'm going to unstrap these, I'm going to place that on there, and I'm going to ask my client to just hold that in place for me. It's probably the only treatment where I allow my client to, in any shape or form, hold any of the products or equipment that we use. So I'm going to get her to hold that side. That now allows me to go wide with this strap to get it over, because I do not want that strap moving. If that strap is loose or it's moving, it means there's a chance that the pad and the sponge underneath is going to move. If it's not tight, it means that the sponge may not be flat on the skin. So you're going to possibly create hot spots, which means they're going to burn in places and not in others. It's going to work in places and not in others. So you really want these nice and securely on. The next thing I'm going to do is check that you have sponge all the way around those pads, in case they've moved when I put them on. And then I'm going to check that those plugs are firmly in. If a certain pair don't work, it's normally because the plugs have come loose while you was working on them. I would then continue to do the second set with the black on the problem area, the third set and the fourth set. We're going to carry on with this one so that you can actually work on each other. So for this set here, I know that this set is connected to my number 4, because I've gone in reverse order. Make sure that you know which ones they are. Because if these were all on, you would be talking to your client all the way through. So you would be saying to your client, okay, Mrs. Brown, I'm now working on this one. And then she will concentrate on sensation and feeling there. And then Miss Brown, I'm now going to be working on this one. So you must know which ones they are and where you've placed them. There's only 4, so it shouldn't be too much of a problem. Now, if the client's never had a treatment before, it's going to be 10 minutes. It will never be over 10 minutes. And then the polarity changes for 5. If the client's had treatments before, the galvanic treatments before, you can go up to 20 minutes for a few of their treatments, but the maximum treatment time would be 30, and that's for someone who is very used to having this treatment done. So that would be a maximum of 30 minutes on plus and 5 minutes on minus. So assuming that all 4 sets of pads are on, I would then say to my client, it's this one that we're concentrating on. You're going to feel a tingling sensation. It feels a little bit like pins and needles. It's perfectly normal. And obviously, if anything then changes or you feel any intense sensation, you must always tell me. So we're going to slowly increase our polarity, dial, our intensity dial, and our client should start to feel tingling, and you're going to check. So she's feeling tingling now. That's fine. Let's get her used to that. We will now do the other 3, assuming they were on. So now we know all the pads are working. We know that they're on. We know that she's feeling sensation from all 4 sets. We know they're working. If they're not, we've got to look at changing them, altering the plugs, altering the wires. Maybe one of the wires is damaged, just change that. It might be one of your outlets that's damaged. So that's hopefully the last thing it would be, because then your machine will probably need to be changed or serviced or mended. So assume we've done all 4. The next thing we're going to do is we're going to take this up, and now for this particular machine, the maximum that you would go to is 4.25, and every single machine is different. You must read the manufacturer's instructions because every single machine is different, and you do not want to exceed what each machine says. So, our client has got 4 pads on. They've done sensation on all 4. We know everything's working fine, and we've gone to the maximum of 4.25. Now, we don't leave our client. We stay with our client. We can keep her warm, just cover her up. I've used a small towel here for the sake of the video, but you would have a full towel covering the body so that she's nice and warm. And she can read a magazine. She can do some work. She can do whatever she wants while this is working. But remember, the first treatment's only 10 minutes anyway. So, assuming our 10 minutes is up, we would uncover the pads again. We would let our client know which one is being turned down. So I'd be saying to my client, right, I'm going to be reducing this one. And then you don't need to go down shockingly fast, but you don't go down slow. You just take the dial down to 0, like that. You're going to do that on all 4. So they're now all on 0. I want to put the pH balance and the acid mantle and reinstate everything that I've taken away by using electricity current on my client's skin. So to do that, I'm going to change my polarity to A-. So on the machine, all of them would go over to a minus, and I now am going to, for just 5 minutes, reapply the current. And I would take it up to where it was originally. Do not leave your client, you stay with her the whole time. If you leave your client and she's feeling uncomfortable, but she didn't want to tell you she was uncomfortable, she'll try to do the dials herself. That you cannot allow. She might turn them the wrong way, she might do something wrong, it's dangerous. So always stay with your client so that she can always tell you that she's comfortable and that everything's fine. So at the end of this treatment, you would do exactly the same thing. You would let the client know which one you are reducing to 0, and you would reduce that dial to 0. And when they're all reduced to 0, I always put the polarity back on plus for my next colleague, so that whoever picks up that machine next, they should check it, absolutely, you don't want to get this wrong, but it's on plus for them, it's all ready for the next treatment. Now there's something that I needed to cover with you. The first thing is before you do any body treatments, you must cleanse the skin. The client may have on their body lotion, she might have on their any kind of product. It just might be dust or grime or anything. If she's been in a skirt and she's walking on the road, you know, things hit your legs or your body, that's got to come off, because these pads, this current, is allowing a product to be pushed deep into the skin. You do not want whatever is sitting on your client's skin to be pushed in with the gel. And it will be, because it's sitting on the surface of the skin. So you always cleanse the skin. And to cleanse the skin, it's a hot bowl of water, 2 spare sponges, body wash, something like Radox, check there's no allergies, check there's no problems with that. Cleanse the skin overhand or circular, just like you would cleanse in the cleanse routine. Clean bowl of water. Get any soap off, because you'll have the same problem. You'll be pushing soap through the skin, which is something you don't want to do either. So get that off. Get a sheet of your bedroll and then just block dry, and then you can proceed with the treatment as we've just done. Now, the client needs to have regular treatments. They have to have these done 2 or 3 times a week, depending on the programme that you've set them. And it must be for a consistent amount of weeks. This treatment is like going to the gym. You can go to the gym once and you'll feel great afterwards, but you're not going to have that big muscly body yet. You've got to work at it. This is the same thing. One of these treatments will do wonders. A course of these treatments will get the client to where she wants to be. And that's when you're going to see the real results. Now, before you do these treatments, if somebody is paying for a course of treatments and they're committed, and you probably gave her one free because she's paid for a course, or you've done something as an incentive for her, you know she's committed. So you need to prove results at the end. And the way you do that is by measuring. So before your client starts any course of treatment, Ferradic or Galvanic or something like that, you would measure with a tape measure the areas that you're working on, and you would make a note of that. Because if the client is dieting and reducing fat content in her diet, then this treatment is going to work far better. If she then now goes and eats a couple of cream cakes and pops to McDonald's, then obviously this is not going to be as effective. Okay? So, you need to make sure that you give the client the right aftercare advice. Now, if she's dieting and she's really focusing on these treatments and the money that she's invested, you will see that she's losing inches. However, with Galvanic, the best indication that these treatments are working is taking a photograph. So you would take a photograph of the area that you're treating at the beginning of the course of treatments, and when she's finished the course of the treatments, you would take another photograph. Now these will be for your client only. You would have access to them obviously, because you need to see the results, but you would treat these under the Data Protection Act. They must be secured very safely if you're printing anything like that. They must be only accessed by a therapist who is working on that client for the same treatment, if it's not you. And they must be either given to your client at the end or destroyed. If you don't have evidence, either in inches or a photograph, the client could, at the end of the treatment, say, I've paid you £400 and I can't see any difference whatsoever. There is no difference, it's exactly the same, I've thrown my money away. And you're going to say, well, I know it's very difficult to notice the difference as we go along, but let me show you the difference. And I'll guarantee you that when you show them the before and after, they're going to say, oh my, I never realised, I really did not realise how effective this treatment was and how well it was working. If you haven't got evidence, then it's your word against hers about how well these treatments have actually worked. So we've covered the consultation, we've covered the treatment, we've covered the danger. Don't go over the amount, don't go over the time, make sure the dials are on 0, make sure they're off, talk to your client all the way through, don't leave her. Aftercare advice. This particular treatment is about cellulite. Cellulite is caused usually by a poor diet. Toxins in the food, additives, preservatives, colourings, takeaways, too much fat in the food. That's generally the biggest cause of cellulite. So obviously your aftercare advice for this treatment is going to be how she changes her lifestyle to prevent those things, so this treatment can not only be more effective, but she can reach her objectives. So that aftercare advice matches your client and the treatment that you're doing. So that's really important. Drinking lots of water, 7 fruit and veg a day, low fat diet, exercise, cardiovascular exercise, how often, how long for, and so on. That is crucial. At the end of this treatment, you do not want your client having heat treatments. You do not want your client going to the gym and doing excessive workout. So for 24 hours, you pretty much want the skin to normalise, to go back to normal, and for the client not to do anything that could cause contractions and cause a reaction to the treatment you've done. So that's really important that you go through all of this advice. Now, on your ranges in your assessment box, there's 2 other pieces of advice for body massage for body electrics that you must cover. The first one is products, and the second one is equipment. This is the best one to get those 2 ranges ticked off. because if you're doing this treatment on a client, you're going to want them to use an anti-cellulite cream at home, morning and night, rubbed into the area. That is definitely something you're going to recommend to your client to help enhance this treatment. When it comes to equipment for this treatment, a body brush. Body brushing has been proven to be possibly the only real effective, apart from the treatment of course, a real effective way from home of reducing cellulite. So you would suggest that they buy a body brush and they use that body brush every single day to disperse toxins, speed up the circulatory, speed up the lymphatic and help this treatment. So that is your aftercare advice and your contractions.